Do you get pain between your shoulder blade and your spine, this area here? Have you tried rolling it out with a tennis ball or a foam roller, but to no avail? In this video, I'm going to show you how to get rid of that shoulder blade pain once and for all, and why right now you're probably just chasing a symptom and not the true cause. That pain between the shoulder blade and your spine in this area here, pain and tenderness in that area, is often called rhomboid pain. Reason being is because you have a muscle that goes from your shoulder blade to your spine called your rhomboids. Because the pain is in that rhomboid area, many people are led to believe that it's the actual rhomboid muscle itself that's causing the pain. However, a couple studies have shown that it's actually the joints and the nerves in the lower cervical spine here that are actually referring pain down to that shoulder blade area. So I'm going to have my friend Sebastian come on over just so we can get a better idea. I keep touching my lapels here. So the lower cervical spine is the lower portion of the neck here, all right, where the lower cervical segments meet the thoracic spine or the upper back. And it's these kind of joints in this area and the nerves in this area that they can get sensitive and they can refer pain down into that medial border of the scapula, so between his shoulder blade and the spine. So if you get tenderness or achiness or pain in that area, that's what we're talking about right here. One of the reasons why we can get tenderness and sensitivity in this area that refers pain down to the shoulder blade is probably because we spend a lot of our day, especially those of us who work from home or work at a desk, we spend the most of our day kind of hunched forward at the desk like this, right? Okay. And if we stay in these positions for prolonged periods throughout the day, those tissues can kind of get stressed and strained and become sensitive and refer pain down, okay? So in this video, we're going to show you how you can kind of test to see if you're actually stiff in those segments and what you can do to fix it. One test that I want you to try at home is the thoracic rotation wall mobility assessment. Okay, so what you're going to do, this is going to see if you are actually tight in this area. I'm going to let you know that most people are, but this is just for you to see. And what I really want you to pay attention to is if you're more stiff on one side versus the other. Okay, so what I want you to do is find a wall in your house. Hopefully you can find one. And get right up next to the wall. You're going to sit your bum back onto your heels and then kind of take the arm facing the wall and just hug your knees right here. With the other hand, you're going to take that guy and come back and just rest it on your low back. And this is testing the rotation mobility of your thoracic spine. So what I want you to try and do is rotate and try and point your shoulder as high as you can towards the ceiling. What we're looking for is at least 45 degrees, okay? So if this is 0 degrees, my shoulders are parallel with the floor. We want to see that I can get my shoulder pointing to at least 45 degrees towards the ceiling. Now we want to make sure we try this on both sides, okay? It's very common that we will have more restriction on one side versus the other, and the more restricted side is usually the one where you can be having some of that pain and discomfort. So let's make sure we test that other side. Again, we're going to kind of get right up and close next to the wall, hips back on your heels, hug your knee. Okay, this hand comes back on the low back, and I'm going to come and try and point that shoulder towards the ceiling. Now, I'm a little bit stiffer on this side, okay? And this is something that I personally have actually struggled with in the past. So during physical therapy school, when I was on the computer for long hours of the day studying, I began to get pain in that area, okay? And this test and the exercises I'm going to show you in just a second have really made a huge difference in making that pain go away. So you did the self-assessment at the wall. Like I said before, almost everybody needs to do some mobility work in this area, but at least you did the test. Maybe you found you're more restricted on one side versus the other, so you know what to pay attention to. So we're going to start trying some exercises that you can do at home to get those segments of the spine moving, okay? Our spine, just like every other joint in our body, craves movement, okay? And we don't move it through its full range of motion as often as we should. So this first exercise we're going to do is called the cat-cow. And for this version, we're going, normally the cat-cow is done hands and knees like this with the bum in the air. But for this version, we're gonna kind of sit our heels, our hips back on our heels, because we kind of want to focus the motion on this upper back, lower neck portion of our spine. Okay, so we sit the heels back, and then we're just gonna kind of flex that spine and stretch, and then go the other way. Okay. We're gonna do this for repetitions. We're gonna be kind of noticing any stiffness. Okay, I just got a little pop. That's totally normal, totally okay. It's a good thing. Getting those joints moving. Okay, now this is my personal secret pro tip here. This is one that really helped me when I was in school and was having some tenderness and discomfort in that area. Okay, so our thoracic spine flexes and extends, and it rotates, but it also side bends. Okay, so we have some lateral flexion. There's not a lot of it because our ribs kind of restrict that motion, but it is one area that needs to be worked on. Okay, this is the one that really helped me. So we're gonna get in that regular cat-cow position, and instead of doing the flexion and extension, we're gonna kind of go side to side. Oh, just got another pop. Okay, so this one really helped me kind of open up those joints right there. Okay, and I can feel it now, even opening up that common area of tightness. So the next exercise you're going to try, so that the cat-cow is more of the kind of flexion extension mobility out of the upper back spine. So this stretch is called the side lying sweep, I like to call it. So you're going to start on your side, all right, and you're going to keep your knees nice and bent up close to you. That keeps the lumbar spine or the lower back out of the motion, and just make sure that all of the motion is coming from your upper back. So you can even hold there, but then you're just going to take your hand and just going to sweep out and then back. I like to do this about 10 times on each side. Again, I'm kind of tighter on the one side, so I'll maybe do 12 or 15 reps on the tighter side. All right, and last but not least, we've kind of opened up the joints, we've mobilized the joints. Now we want to do just a little bit of strengthening. Again, that area of our body doesn't get enough attention, especially because a lot of us are like this for long periods of the day. So we've kind of opened up those joints. Now we just want to kind of strengthen those muscles and get some blood in there. So one of my favorite exercises with the band is just the reverse fly. Okay, so you're just going to hold the band like this, palms facing, good posture, shoulder blades down, and you're just going to pull out like that and squeeze those shoulder blades together. Okay, we want to get those muscles between the shoulder blades activating and get some blood in there. Okay, you can do this for about 15 to 20 reps. That's it for this video. I hope you liked it. I hope you learned something. You can throw this guy away, all right? No, you could still use that. If that provides you some temporary relief, that's totally fine to do. But just know that it's usually the joints and the nerves, the tissues in this area of the upper back, lower neck, that are actually just referring pain down to the shoulder blades. So if you're rolling out the rhomboid muscle or those muscles between the shoulder blades, you're probably just kind of chasing a symptom and not getting to the true root cause of the problem. So start mobilizing your spine and strengthening those muscles back there to see long-term relief.